You will get tested on personality disorders, so you have to know how to recognize them quickly, which is what we are going to do in this video. The personality disorders can be categorized into 3 different groups: Cluster A, the weird; Cluster B, the wild; and Cluster C, the worried. In Cluster A, there's schizoid, schizotypal, and paranoid personality disorder. First, we're going to talk about paranoid personality disorder. So with paranoid personality disorder, there's the strong distrust and suspiciousness of others, and they interpret others' motives as malevolent. They also have a tendency to blame others for their problems, and they are quick to counteract when perceiving attacks on their character. Now, it's incredibly important to differentiate between paranoid personality disorder and delusional disorder because they can present very similar, which is why test makers like to put both of them in the answer choices. So with paranoid personality disorder, they're paranoid about a bunch of different people in a bunch of different situations, whereas with delusional disorder, they tend to have this paranoid delusion about one particular person or one particular situation. We have schizoid personality disorder. Now, for schizoid personality disorder, there's this lifelong pattern of social withdrawal, there's no desire for close relationships, and there's this perceived reclusiveness that they have. They are indifferent to praise or criticism. They like being alone. They do really well in positions like IT where they don't have to interact with a lot of people. Now, you have to know how to distinguish between schizoid personality disorder and avoidant personality disorder because they both can be very reclusive and keep to themselves. But the difference is that schizoid personality disorder, the patients prefer to be alone. Like, they have no problem not interacting with others. Whereas avoidant personality disorder, they want to interact with others, but they feel inadequate. So that's going to be what you want to look for on the exam question. Now we have schizotypal personality disorder. So for schizotypal, there's this pattern of eccentric behavior and peculiar thought patterns. They may exhibit odd beliefs or magical thinking, like they're really into crystals. They may talk in a way that just sounds kind of weird, and they may have very weird clothing. So they're just going to be odd. Now, it's important to note that a minority may actually progress to schizophrenia. It's not commonly asked on a USMLE question, but it can be asked on a PRITE question. Now we have the Cluster B personality disorders, which are antisocial, borderline, histrionic, and narcissistic. First, we're going to discuss antisocial personality disorder. So when you think of antisocial personality disorder, for the test questions, think of criminal behavior. They exploit and violate the rights of others, and they lack empathy, compassion, and remorse. Now, they must be at least the age of 18 to be diagnosed, and they must have a history consistent with conduct disorder before the age of 15. If they are younger than 18 years old, they are diagnosed with conduct disorder. And you need to remember these ages because test makers like to see if you can remember the age timeline. If you have someone that is 17 years old, they're diagnosed with conduct disorder. If you have someone that's 19 years old, then they would be diagnosed with antisocial. Next, we have borderline personality disorder. Now, borderline personality disorder is going to be tested more than any other personality disorder, and this is because they are so unstable that they are frequently on the psych ward. So they have unstable moods, unstable behaviors, and unstable interpersonal relationships. They have this innate fear of abandonment and impulsivity, and they have recurrent suicidal threats or self-mutilation behavior, typically associated with this feeling of being abandoned. So they are going to frequently cut, burn, have suicide attempts, threaten suicide if they feel like they are being abandoned. And then they have splitting behaviors as well. Someone's really great while someone else is absolutely terrible. For them, the treatment is dialectical behavior therapy. So the answer for therapy is typically CBT, but if the question is about someone with borderline personality disorder, it is DBT. So we have histrionic personality disorder. Now, histrionic personality disorder is very dramatic and shallow. So they exhibit excessive emotionality and attention-seeking behavior. They are dramatic, flirtatious, and they are unable to form long-lasting, meaningful relationships because their relationships tend to be very superficial. They may use the defense mechanism of regression. So they resort back to childlike behaviors. And this may come up in a board question more so than a USMLE question. Now we have narcissistic personality disorder. Now, narcissistic personality disorder can be recognized by their sense of superiority, grandiosity, and strong need for admiration. They typically lack empathy like antisocial, and they will exploit others, often for status and recognition. But the way that you can distinguish them from antisocial personality disorder is antisocial tends to have more criminal-like behavior, and narcissistic personality disorder tends to have more of this sense of superiority and grandiosity that will be displayed in the test question. Now we have cluster C personality disorders, the final cluster. They are avoidant, dependent, and obsessive compulsive personality disorder. We'll start with avoidant personality disorder. So for avoidant personality disorder, they have this social inhibition and intense fear of rejection because they feel inadequate. They desire companionship, but they are too shy and easily injured to actually pursue these relationships that they want. It's important to be able to distinguish between avoidant personality disorder and social anxiety disorder because they can present very similar. But avoidant personality disorder has this fear of rejection and feeling of inadequacy, whereas social anxiety has a fear of embarrassment. So look for those wordings in the test question. We have dependent personality disorder. Now, dependent personality disorder has this excessive need to be taken care of. They have low self-confidence and they fear separation from others. They allow others to make decisions for them. So in the test questions, they'll often go from relationship to relationship, needing that person to make relationships for them, and they decompensate if they no longer have that relationship that can make those decisions for them. Now we have obsessive compulsive personality disorder. So obsessive compulsive personality disorder has this pervasive pattern of perfectionism, inflexibility, and orderliness. They are preoccupied with the details and they may be unable to complete tasks in a timely fashion because they have this perfectionism that really slows them down. Now, you do need to know the difference between OCD and OCPD. OCPD symptoms are ego-syntonic. And the way to remember this is OCD annoy themselves, whereas OCPD annoys others. So people with obsessive compulsive personality disorder are going to annoy the people around them, and they're not going to see any issue with their rigidness and perfectionism. Whereas OCD, they're going to be bothered by their obsession compulsions. All right, let's do a rapid review before we end the video. Cluster A is going to be schizoid, which are reclusive, schizotypal, which are weird, paranoid personality disorder, which are paranoid. Cluster B, you have antisocial personality disorder, a disregard for others, borderline personality disorder, they're unstable plus often self-harm, histrionic personality disorder, dramatic and shallow, and the narcissistic personality disorder, which present very grandiose. Cluster C personality disorders, avoidant personality disorder, fears rejection, dependent personality disorder, they're dependent on others. And then obsessive compulsive personality disorder, they're very rigid. That is it for today. I hope this gets you some easy points on your exam. If you want more easy points for your exam, watch the other high yield videos.